So it is my great pleasure and honor to introduce our friends and mentors from Korean Minimal Invasive Spine Society. Dr. Harrison Kim, the president of Korean KOMI Society, and Dr. Choi, scientific chair, will teach us in advanced techniques in both uniportal and biportal techniques.
Thank you, Chairman. Good morning, ladies and gentlemen. I am Hyun-Sung Harrison Kim from Harrison Spine Hospital, South Korea. It's my great honor to give a talk in Spine Summit, and I'm a uniportal surgeon, and also my English is very weak. Please understand. Today, my talk is that some uniportal endoscopic decompression of the cervicothoracic stenosis. This is my curriculum and disclosure. We know that some endoscopic spine surgery developed by the fourth generation. You can see here there's some, during last time we can overcome so many things of the discectomy and decompression and fusion, now going on the fusion generation. But still my final point will be in the degenerative spinal disease by the endoscopic spine surgery will be some deformity and then cervical and thoracic decompression. Today I will discuss about that the cervicothoracic decompression. Fortunately, I already published that some degenerative scores overcome by the endoscopically, and you can see here the result that. And also because today I will talk about that some endoscopic decompression of cervical and thoracic point. And before I'm talking about that some endoscopic lumbosacral fusion in Korea, because of that many doctors still cannot accept the endoscopic fusion. It will not good compared to the open surgery. But you can see here the first case, you can see that this kind of restoration sufficiently, and second things also looks like very difficult, but it looks restoration very good. And the third case, you can see here the some this we can insert a larger angled cage insertion is possible in the only posterior approach. That is more good to the patient. Also, in the degenerative deformity cases, you can see here the first case is failed back surgery cases. Also, degenerative correction is very good, and second case also you can see the result is very good. And also, third cases of degenerative deformity can correct it, and also in some of degenerative kyphosis also can overcome using by the endoscopically like this. And also you can see the last case, it looks like very, very difficult. But using the endoscopic lumbosacral fusion, there is a very advantage to correct this deformity in degenerative deformity cases. In the concept of endoscopic decompression, lumbar, thoracic, and cervical, you can see this is my paper. See the some concept is here. You can see this over the top and outside is very important because of that. In the lumbar area, the endoscopic decompression is not a danger to the nerve area, but in the thoracic and cervical is very danger to nerve damage because keep this over the top and the outsiding is very important to preserving the nerve damage during the operation. You can see this over the top, and the outsiding meaning that the firstly during the outside this area, and then finally take out the calcified ossified ligament problem or some point of the resect point, final take out. And then and also it can possible to decompress like this single level, but in the especially in the cervical area, like multi-level resection procedures, I recommend this procedures. Firstly, drilling around the oral area, and finally remain the island block and take out this oral piece by the one piece by using the island block and take out. Then you can see this image, and you can see. This case need a two-level decompression, and after operation, you can see the island block takeout, and after operation, you can see the patient result is very excellent. And also, this can possible by the separately, and sometimes by the one process is possible. And also, postoperatively, you can see the resection is sufficiently, decompression is sufficiently. And I will show the cases. This case is a myelopathic weakness patient with thoracic OLF, and after operation you can see decompression sufficiently, and also the patient walking is very good. If this patient doing the operation before, it needs some overall complication will very higher, but and using the endoscopic decompression, it can decrease so much. And also some another cases looks like this 83-year-old female patient with the ossified ligament flap with the myelopathy with some walking disturbance, and after operation you can see the decompression is very good. And also this patient, if receive the open surgery, you can see here the some higher chance of the complication. Also, in spite of that, very old the patient can only stay 1 or 3 days is possible. And also this patient have some stenosis with some disc protrusion together, and also then the patient walking is very difficult before. Only 1 day after operation you can see the patient walking is very good. But if this patient have some open surgery, this patient needs some fusion surgery, and also some, because of that, this patient has some chance of some mortality and some higher chance of complications. But using the endoscopic decompression, it can decrease so much. And also the patient have some chance of the more return to their normal life like this. And also this patient is some C7T1 higher level cervical myelopathy patient. This also very difficult before, but this patient, you can see the after operation, the decompression very good, and also the patient motor recovered completely. But if this patient have received the conventional open surgery, it maybe need some. Most difficult point will be this patient will have some chance of the nerve damage due to the myelopathy. But if we doing the endoscopic decompression, the patient more good chance to recovery, and this patient also recovered completely. And also the another cases, several cases, also decompression is very well. And also using this patient can possible by the anterior approach and posterior approach by the open surgery. Anyway, this patient also have a higher chance of complication of dysphagia and C5 palsy. But in the endoscopic decompression, this chance decrease so much. Only complication rate so lower using by the endoscopic decompression. This another cases. 3-level decompression cases also 1 year follow-up, you can see the decompression is very good, and also the skin is very less damage of the skin. Because of that, the instability not happen. And also in these cases, maybe we have some open surgery in need of fusion surgery or some laminoplasty. Also, there also some higher chance of several complications of kyphosis and some muscle back pain and neck pain. But in endoscopic decompression, it will disappear. And these another cases of higher level myelopathic cases also same result like open surgery is showing the higher chance of the complication. This another cases 2334 higher level stenosis cases also show the post-operative good result. But in the open surgery, it have some higher chance of complication like this. And also this another cases you can see the this patient beat me with the weakness, but after operation, good decompression, the patient have a complete return to recover his weakness. And also in like these cases, also open surgery have a higher chance of the nerve damage and some complication like this. But in the endoscopic decompression, it can decrease so much. These another cases for very severe stenosis cases also showing the good decompression and take a good clinical result. And in this Jens Falco talking that this patient most good option is will be the endoscopic decompression. And this another case is showing that in the cases like this cases, cervical, thoracic, and lumbar cases, combined cases, by the endoscopic decompression only. If this patient receive the operation, he need a fusion surgery and several complications in the only 54-year-old male patient. But we using the endoscopic decompression, the patient have a complete chance to his normal return normal life. In conclusion, currently my hospital using more than 95% of degenerative disease and only some cases open surgery, mostly doing the endoscopic decompression. It means that I believe that in the future we will move to the robotic surgery, but I believe that the gateway to robotic surgery will be the endoscopic spine surgery. Thank you for your kind attention.
Thank you.